Before beginning, as with any procedure, verify the doctor's order. Also, since there may be variations in the frequency for changing the dressing and the type of cleanser used, verify hospital policy. Identify the patient, checking the armband, and verifying the patient's name and birth date. Explain the procedure to the patient and assess for any allergies by checking both the chart and asking the patient. Provide privacy. Assess the insertion site through the dressing, noting for any drainage. This determines if a culture swab is needed. Then gather the needed equipment: a central line dressing kit, clean gloves, extra mask for the patient, tape, pen, and culture swabs if indicated. Position the bedside table on the side closest to the central line at waist level. This helps to maintain the sterility of the supplies. Place the equipment on the clean, flat surface and position your trash can. Perform hand hygiene. Raise the bed to a working height. And lower the side rail. Place the patient in a comfortable position with the head slightly elevated. Remove the dressing kit from the plastic wrapper, opening the first flap to expose the mask. Don the mask. And assist the patient to put on a mask. Making sure the nose and mouth are both covered. Don clean gloves. While stabilizing the catheter, carefully remove the soiled dressing by lifting and removing the transparent dressing toward the insertion site. Assess the catheter, the insertion site without touching it, and the surrounding skin. If a culture is needed, obtain it at this time. Remove clean gloves and properly dispose of the gloves and old dressing. Perform hand hygiene. While maintaining sterile technique, open the kit and don sterile gloves. keeping your hand above your waist at all times. Arrange and organize the supplies on the sterile field well within the 1-inch border and make sure no item is contaminated. Be careful not to reach over the sterile field. First, clean with the alcohol swab, beginning at the insertion site and maintaining circular movements outward. Be very careful to avoid crossing over the same area twice. At this point, if the non-dominant hand has touched the catheter, that hand is now contaminated and should not reach back into the sterile field. Activate the ChloraPrep applicator by squeezing the wings and allowing the fluid to flow downward into the sponge tip. Vigorously cleanse the catheter and site using a back and forth motion for a minimum of 30 seconds. Allow the area to dry completely. Apply the sterile transparent dressing over the insertion site. Ensuring that the dressing is smooth and the edges are adhered completely. Properly remove and dispose of the gloves, and then the mask. Remove the patient's mask and discard. Prepare a label with the date, time, and initials, and apply to the edge of the dressing, being sure not to cover the insertion site. Raise the side rail. Lower the bed. And place the patient in a comfortable position with the call light in reach. Dispose of all equipment. Perform hand hygiene. Then document, being sure to describe the site appearance, any drainage, noting the amount, characteristics, and if any cultures were obtained, the type of cleanser used, the type of dressing applied, the patient's tolerance of the procedure, along with the date, time, and signature.